Welcome to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine that we put together here at the Virginia Institute for Public Policy so that you go into these discussions that I know you're going to have around water coolers and barbecue pits and back-to-school sales and move-in days. And you're going to go in armed with real information, real background, and depth of field vision that helps you navigate some of the nonsense that become talking points right off the headline writer's page. We begin with a story that has bubbled under in conservative circles for quite some time. Do you have a right to Twitter? Do you have a First Amendment right to have a Facebook page? What can be changed? What can be throttled? What is Facebook's responsibility? Are they a publisher or just an aggregator? To help us get through some of this as these tech firms, especially the ones in the social media world, have gone from just throttling back conservatives to outright banning groups like InfoWars and Alex Jones. David Williams is the president of the Taxpayers Protection Alliance. David, how are you doing this weekend, sir? And thank you for joining us.
Thank you very much. I'm doing fantastic. And there are a lot of issues to talk about when it comes to the Internet, technology, the Internet, as I said. So, there's a lot that needs to be discussed because do we go towards government regulation or away from government regulation of the Internet?
Well, I worry about the Cloward and Piven strategy of overwhelm a system, and then once it's collapsed, you can remake it in your own state-run sort of way. And I feel like there's a certain sense I have that in this issue of tech responsibility, real news, fake news, Russian internet sites, I feel like there's a certain amount of we're the cat chasing the laser pointer on the wall, and the desire is to get us to knock over the potted plant so then they can remake the potted plant in their own way. And I'm really cautious about this issue because I was there through the whole Napster debate. Alan Tipper Gore, and we need to have the government intercede and stop Napster from doing what it's doing, until the marketplace said, hey, we can sell our own singles. We don't need Napster to do it. And maybe there's a market lesson to be learned there. So I get cautious about the idea that the government needs to do something about it. Where do you stand, and what have you seen? Do you share that same sense of foreboding that there's more going on here than meets the eye?
I do. And let's start at the beginning, is that the Internet really flourished because the government took a hands-off approach. The government said, you know what, we're going to let the private sector, we're going to let the free market develop the Internet, the access to the Internet. And over the past 15 or 20 years, look how far we have come. I've been doing this job for 25 years, and it's amazing. I'm talking to you on an iPhone. iPhones didn't exist when I first started doing this.
Absolutely.
Many decades ago. So we see just how available information is and the Internet is. And it's because the government took a back seat that allowed the private sector to do this. And now we have a bunch of Democrats that are saying, we want the government to regulate the Internet. We want the government to have more control. And that's just the wrong way to go. It's the absolute wrong way to go, because you're going to have the investment in broadband and the Internet diminish, and it's just, whenever the government gets involved in something, it messes it up. That's just simple, and you've seen it over and over again.
And that's where I worry about some of the stuff that Facebook and Twitter and some of these social media sites are targeting conservative, whether it's Diamond and Silk or Alex Jones, and they become high profile. But I worry that they're sort of trying to herd us into the place where we're like, yeah, you know what? Let's get that net neutrality. As long as we know that the conservatives are going to get an equal, fair, government-regulated say, I just worry that we're kind of being driven to agree with the idea of the government needs to run the Internet.
And it's frustrating. It's frustrating to see conservative voices that are being quieted, whether it's on Facebook, Twitter. And I'm as frustrated as the next guy, but I'm also a small government guy. And I don't want the government to get too involved in this. And listen, Mark Zuckerberg and these guys have done themselves no favors.
Oh, yeah.
And they're, almost begging for regulation of them, which I think is the wrong thing to do. And if you're a free market person, if you're a small government person, you don't want the government to start regulating Facebook and Twitter. First of all, they're private platforms. And if you don't like Facebook, don't use it. If you don't like Twitter, don't use it.
Mm-hmm.
So yes, it's disgusting what they're doing, but do we really want to establish that kind of precedent where the next administration may not be as friendly to conservatives and libertarians? And what happens? The pendulum's going to swing the other way, and we're going to be in a lot of trouble.
Well, we just look at what the IRS did to some of the Tea Party organizations when they had the opportunity to throttle their ability to impact the 2008-2009 election cycle and into 2010, where they were holding up their 401c3 approvals and their tax-exempt status, so they couldn't hold events and they couldn't do fundraising. And I think is that a fair yardstick to say if you allow the government to regulate the internet, this is the same kind of behavior that could happen?
I think it's a great comparison because I started this organization in 2011, and we had some pushback from the IRS, and we eventually got our 501c4 status approved, but it was not easy. So, I was somewhere else for 18 years, but then started this 7 years ago, and I saw the full impact of what big government can do. And this is what happens is once you get the government involved, it just grows. The government doesn't say, "Oh, we're going to only have 2 people, look at this regulation." It's like, no, we have to regulate more, so we're going to have to hire more people. There's going to be a lot more micromanagement. So it doesn't stop. I mean, this is just like a fungus; it just keeps on growing and strangling businesses and individuals.
And, of course, each layer adds another politician or 6 that's going to run around and see some ability to go mail out a mailer saying, look at me looking out for you by creating regulation X, Y, or Z, even beyond the regular swamp creatures of the bureaucracy. You mentioned Mark Zuckerberg and his pleas to the government, please regulate me, almost like a character from the old Saturday Night Live Miles Copperthwaite skit, please punish me next, and which should be indicative of the fact that he knows that he'll be the guy that gets to call the tune. But add to that the historic losses in user numbers, advertising revenue, stock value. The values were billions of dollars in days out of Mark Zuckerberg's pocket. Isn't that the marketplace doing what the government never could be able to do, that kind of punishment?
Isn't it funny how the market works? People were upset with Facebook, and guess what? They lost money. I mean, this is exactly what happened. Is they said, I'm concerned about Facebook's privacy. I'm concerned about a lot of things that Zuckerberg is doing, and they lost a lot of market value. But at the end of the day, Facebook will always have, and big companies like Facebook will always have a lot of money and the resources to put up the regulations. The problem is new regulations are going to strangle and keep small businesses from coming into the marketplace. That's my concern, is that you're going to have small businesses that say, listen, I can't comply with that. I'm a 2-person shop. I'm not going to be able to do that. But Mark Zuckerberg, who still has hundreds of billions of dollars, will be able to comply. And that's why he is doing this, is that he wants to, this is kind of backdoor corporate welfare and backdoor, regulation to help him, to keep him in business while others stay out.
Well, and funny enough, some of the same people who are promoting the idea of this are the ones who will scream about corporate welfare, whether it's an oil company or tax incentives for this, that, or the other thing, David, that I guess it's good for the goose, but not for the gander. On the other side of it, I don't think Alex Jones's InfoWars website and paywall establishment has ever seen as much business as they do now. Diamond and Silk, very few people had ever even heard of them as talk show hosts until this began. So one could make the argument that they're not necessarily aggrieved parties in this. They have benefited actually from this. What about the possibility of somebody like, I'm just going to pick the deepest pockets I can think of off the top of my head, the Koch brothers starting a Facebook that's a conservative Facebook, if you will, an alternative alt Facebook, if you will?
I would love to see that. I would love to see an alternative Facebook, an alternative Twitter. I mean, that's what this country is all about, is building a better mousetrap, or a different mousetrap for that matter. So, you mentioned Alex Jones, and what an interesting kind of phenomenon is that ever since he was banned from Twitter and these other platforms, he has become more popular. People are subscribing to his podcast. So this backfired. Listen, it backfired on the folks that are trying to take away his free speech, and it's actually helping them now. So, it's kind of the thing, the forbidden fruit is always the sweetest, and that is what's happening with this. And that's why I think it's going to backfire on them. And listen, this is a little bit about free speech. It's frustrating when they ban people. But again, these are private platforms, and they get to make the rules. And unfortunately, some of the rules, they hurt conservatives. But again, there's nothing stopping from the Koch brothers or Tom Steyer or anyone on any side creating their own platforms to do this.
Michael Bloomberg did it with his radio network, and he decided he didn't like the Wall Street Journal, so he started his own magazine to counteract it. David Williams is the president of the Taxpayers Protection Alliance. You can find them online at protectingtaxpayers.org. And David, I want to take another tack to this. We were talking about the social media platforms throttling conservative websites, that kind of thing. But under that subtext also still bubbles the net neutrality idea, the internet sales tax ruling, because I still see, as you mentioned in the last segment where we were talking about Mark Zuckerberg is fine with big regulations. He can fold the cost of compliance in where a little guy can't. I still see all of this bubbling under with taxation, national security requests out of NSA saying, well, this internet thing, we need to monitor it to see who's talking to who. There are still many tendrils touching into the internet that we need to be pushing back on, don't we?
We do. And we have a group of Democrats in the House and in the Senate that want to give the government more control over the internet. And this is not going to close the digital divide. There are a lot of people that don't have access to broadband. And what we want to do is make sure that they do. But just throwing money at a problem, I mean, come on. If we learned anything over the last few decades, just throwing money at a problem doesn't solve it. You have to have real and good, solid ideas to fix the problem. And here's a little bit of an anecdote. So Senator Markey from Massachusetts, the reason that he wants to bring back net neutrality in Title II and regulate the internet is that, and I'm not kidding, he said this, that in the 1990s, a school that he was visiting didn't have internet. The 1990s. This is almost 30 years ago that he's comparing what had happened 30 years ago to today. Obviously, things are vastly different, but he wants to regulate the internet because it's something he saw in the 1990s.
Our founder here at the Virginia Institute was always fond of saying that regarding technology, that up until the deregulation of the phone company, the only innovation Ma Bell ever came up with was switching from the rotary phone to the touch-style phone. And that was really to save themselves money. It made it easier to auto-operate the system. But then you deregulate it, and all of a sudden, as you mentioned, the iPhone, and then you add to it the breakup of the big the military government technology complex in the late 80s, early 90s after the Cold War ended, and all these companies said, hey, can we do something else with this technology if we're not going to sell it to the government? And actually, by removing the government from their marketplace, an amazing boom was created from that. What lessons should we learn from all of that, David?
Well, we've learned that the free market works and that trillions of dollars have been spent to make speeds faster, to more deployment for broadband. So it's working. And I don't understand why, like Democrats, and think about this for a second, that Trump is president. We have Ajit Pai, who's the SEC chairman. He's Republican. He's conservative. And the Democrats want to give those two more power.
That is true.
It makes a lot of sense.
Well, let me ask you about then as we move forward into the future of this, because I look at these smartphones as amazing tools. You talked about the little guy being able to compete with the big guy, being able to ship, being able to get products out into the marketplace without having to get picked up by Target or Walmart. They can sell direct to consumer, that kind of thing. How hard is it going to be? How much fighting are we going to need to do over the next few years to make sure that stays a reality rather than just a quaint old relic of the past?
Well, I think we have to urge Congress is to keep their hands off the internet, and that what they can do is pass bipartisan legislation that keeps the internet free, of government regulation. And that's what our goal right now is, talking to both Democrats and Republicans. Obviously, Democrats aren't listening to us that much, but we're hoping that this is bipartisan legislation that we can get passed to say keep the Internet free and open without government regulation. And you mentioned the little guy. Look at the app economy. Look at your phone. You have all these apps.
Mm-hmm.
Some of them are big businesses, but I got to tell you, most of these apps are small guys and one or two guy shops or women's shops that are making these things and making a lot of money because we've had this. We've had the absence of government regulation, and we're just concerned that it's going to hurt the economy as a whole if the government gets back in the internet regulation business.
One of our two senators, Mark Warner, made his fortune in a heavily regulated cellular communications business before selling his company to a Kansas company, promising all the Virginians they'd keep their job. And as soon as he was elected to Senate, they moved everyone out to Kansas, or at least lost their jobs. But anyway, regardless of Mark Warner's history, he has said recently that we need new governing principles for the Internet and this technology age, and all that scary left-wing rhetoric of, the founding fathers never took the Internet into consideration when they wrote things like the Fourth Amendment or the First Amendment. I read these documents almost daily. It's a little weird, but they're not long, and the statements are so clear and so obviously applicable still to this day to the Internet, David. Is it purely just out of the zeal for state control? Do they think that this kind of faux mysticism that they pretend the Internet is will make the majority of voters think that they deserve different amendments than the First and Fourth and those controls over the government? Because to me, the First, Fourth, all these amendments still apply directly to the Internet as well as they do to any speech.
Oh, they absolutely do. And that's a great point, is that you have politicians that are saying, protect me from myself, thinking that the public needs to be protected from itself. Guess what? We're fine. And we're going to figure this out. And, there's going to be some, learning curves and some growing pains as we go with more social media. But this is exactly what the Founding Fathers had in mind, is a hands-off approach. The Constitution isn't 5,000 pages.
Right.
And there's a reason why the Constitution isn't 5,000 pages. And there's a reason why Obamacare was. Is that one it micromanages, the other doesn't. So I think that's really the difference here. They knew that the times they are changing, and they were going to change. And, obviously they had no idea Facebook would exist, but, they left it very open to the possibility of anything happening. And that's why I think the Constitution will always be an evergreen document.
If we go back to the place where law enforcement has to be strictly regulated by the burden of proof, the Fourth Amendment is perfectly applicable to the Internet and to our computers.
It is, and I'm glad you brought up the search and seizure and the FISA situation, because I believe that is something the left and the right can agree on, is that there aren't a lot of things we agree on these days, but I think searches and seizures and that constitutional issue is something that we should come together on and demand a lot more accountability from the government when it comes to the FISA warrants and the searches. Absolutely.
Except for Alex Jones's computer, right?
Well, yeah.
Hey, David, thank you so much for where we are. Certainly the midterms are going to be an interesting time from a group that's protecting taxpayers, the Taxpayers Protection Alliance, because what happens in November can really change what the tax rates look like. We're kind of tacking in the right direction, it seems like. But thank you for all the work that you do for us there, protectingtaxpayers.org. And thank you for joining us this week on Freedom and Prosperity Radio.
Great. Thank you so much for having me.
Coming up next, from the Heritage Foundation, their Domestic Policy Studies Director, Marie Fishpaw, on HHS and short-term health plans, coming up on Freedom and Prosperity Radio. Welcome back to this week's edition of Freedom and Prosperity Radio. Joining us now, healthcare has been in the news across Virginia for specific reasons, but there are rules afoot that are trying to make healthcare at least back walking away from the precipice of Obamacare. Health and Human Services rulings regarding short-term health plans on the on the front burner out of Washington as well, and we're going to get into it. Edmund Haislmaier is the Director for Healthcare Policy at the Heritage Foundation, Preston Wells Senior Research Fellow under Healthcare Reform, and he joins us now. Ed, thanks for taking some time out for us this weekend on Freedom and Prosperity Radio. How are you doing, sir?
All right. How are you?
Excellent. So, first, break down this rule that the Health and Human Services have put forth regarding short-term health care plans, and how does it impact each of us individually going forward, so that we don't have to get one of these cookie-cutter, one-size-fits-all super policies?
Well, basically, when Congress first applied some rules to health insurance was back in 1996, and one of the things that they did was to say that a short-term policy doesn't count as a individual market policy for purposes of new federal rules and regulations.
Okay.
And that was back in 1996. And then Obamacare comes along, and they just added more federal rules and regulations to individual and small group policies, but they didn't change that part of the law. So what happens is these rules and regulations don't apply to what are called short-term policies. Now, back 20 years ago when Congress did that, then HHS had to figure out, well, what did Congress mean by short-term? So what they did back then was to say, well, short-term is anything of a year or less, and where the policyholder can't just keep renewing it year after year. And that was that way for 20 years. At the end of the Obama administration, because health insurance under Obamacare in the individual market becomes so expensive, people started to shift to try to buy short-term policies. In fact, interestingly enough, I had a research assistant last year. Her parents have a contracting business, and they had done that. They had shifted to short-term policies, because if you're healthy, you can get a much cheaper policy. So the Obama administration tried to force everybody into Obamacare by saying, well, instead of short-term being defined as a year, we're going to make it only 3 months to really force people out of those policies. And so what the Trump administration has done is they've gone back and they've reversed that. They said, no, we're going to go back to the definition that was there for 20 years, that it's a year or less. And furthermore, we're going to write it in a way so that if states and insurers want to replace those policies with new policies and guarantee you a right to get, another policy for another year, that's okay with the federal government. And the idea is to let people who are self-employed and not getting a subsidy from Obamacare but forced to pay higher premiums under Obamacare to opt out and get more affordable coverage.
And it seems like, I think if I recall correctly, the Obama administration and the president's HHS director at the time felt that the people were using these short-term health care plans as a dodge.
Absolutely. And they were, as I said, there were people, because basically what happened under Obamacare is the individual market, Obamacare, because of the subsidies, because of the rating rules, it attracted, and also because of the way Obamacare was written, it attracted into the individual market a lot of people with medical conditions looking for subsidized coverage who, in many cases, had been on other coverage already. And that made the cost of those policies much higher, and the people who were traditionally buying individual coverage prior to Obamacare were people who were not particularly sick. I mean, they weren't super healthy, but they were basically self-employed people who didn't have access to employer coverage that was tax-free, and offered by an employer because they work for themselves, and small businesses. And then you did have some people buying these legitimately short-term or transitional policies. So, for example, you're leaving school but you haven't got a job yet, or you're between jobs, or you're an early retiree and you haven't qualified for Medicare yet. You need the policy for a year, 6 months, something like that. That was what was going on in the market. I think what will happen eventually is that for people who are not in the employer group market on a long-term basis because they're self-employed, I think the other changes that the Trump administration has made to association health plans is where those people are going to wind up, like my research assistant's parents who have a contracting business. I mean, people like that who are self-employed, small business owners, people like that are going to eventually move into plans under because this is something else the Trump administration has done. Association plans run by the local chamber of commerce or something like that. But until those get set up, these short-term plans are out there right now, so you could buy one off the shelf. Now, eventually, when the others are set up, then I think the short-term market is basically going to be people looking for short-term coverage, as it was in the past.
Is the and I want to stick a pin into the idea of where we are in this evolution from the initial Obamacare to hopefully getting something better for patients, doctors, and that kind of thing, Ed. But I want to follow up on the association policies because it's been, if I'm not mistaken, a year. Of course, I could be judging time badly, and it seems like that was permitted, but now really hasn't manifested as much as many would have thought, or is it just getting undercovered?
No. The rule was just approved a few months ago, published a few months ago, and I would expect it's going to take some time to get underway in a lot of places, and that's why I'm saying I think as a long-term solution for self-employed people, that's probably where, say, in 5 years, a lot of these people wind up. But it depends very much on where you are today, whether that will be an option in the near term. So, for example, I assume they still do it. I came across this years ago. I don't know if they still do it. But in Lubbock, Texas, the Chamber of Commerce was running an association plan. I remember talking with folks doing that, years ago. So under these rules, if they're doing that today still, then it would be fairly easy for them to expand that plan to include self-employed people. See, because the issue is, if you're self-employed, on the one hand, are you an employer for purposes of belonging to the association and running the health plan collectively? And are you an employee for purposes of getting coverage under the health plan? It used to be you could be one or the other, but not both, and that's what this rule is about.
Well, and certainly
so in some place like Lubbock, people could do this right away. If there's a place where there isn't an association plan already there, then yeah, it's probably going to take several years for somebody to come along, set it up,
And we're talking in these cases self-employed. I mean, that's a boom these days with the gig economy taking off in ways that probably hadn't even been thought of in 2008 when Obamacare started to get written. Is the idea of Uber and Lyft and so many other things that are people are using as income generators aside from even just subcontracting out to corporate jobs that they had even before this.
Right, and that's what is concerning about the effect that Obamacare has had on driving those people out of the market, because you're essentially saying, well, you can choose. You have to choose between being, having affordable insurance or having self-employment. You can't have both, and that's been the problem with Obamacare. And so what these two ruling changes are designed to do is to address that to the extent that the administration can without Congress already changing, going further and changing the law. And that's what we're proposing, and a lot of other conservative groups have proposed that Congress has to get back to actually remedying some of these problems by changing the law. I mean, basically the problem that you've got is Obamacare was focused on helping people who were low income and had medical needs that needed to be paid for.
Yeah.
They were not focused on providing insurance protection for the traditional self-employed small business owners and workers. And so they sort of stuck these two together, and they just really don't belong together. And so that's what we're seeing with Obamacare. What we're seeing is that the subsidized Obamacare coverage is expensive, but the people on it are okay because most of the extra cost is picked up by subsidies, and it's basically a big high-risk pool.
Edward Haislmaier is the Senior Research Fellow in Healthcare Policy and Markets for the Heritage Foundation, on with us this week at Freedom and Prosperity Radio. And I know much consternation over the first couple of years of the Trump presidency is that Congress has been unable to undo Obamacare. And this recently, Anthem applied for, and again, as some of these things just make you shake your head that somebody has to ask for permission to provide health care coverage for Virginians, giving at least Virginians now a second choice for health care coverage where most had found themselves with only one choice, and it was a pretty bad choice as well with Optima. Where are we in unraveling this tangled web of Obamacare, Ed? Is it ever going to be done, or are we just continuing to throw new spices into a bad loaf of bread, hoping to make it taste better?
Well, I think what's going to happen, and this is proceeding. I mean, the interesting thing is, that markets, and no surprise to you, markets don't sit still and wait for government. They find workarounds. So what's happening is really, as I said, they stuck together in Obamacare two markets that really didn't belong together. One was people who were low income with health conditions looking for subsidized medical care. The other was middle income, self-employed, small business people who were basically just looking for traditional insurance protection. Those two markets don't belong together. The market that resulted is now, in my view, self-segregating. So what we're starting to see already is that you're seeing different insurers offering different coverage and people going in the market splitting. Furthermore, states have applied for waivers to do exactly that, to split the market and say, look, let's use the taxpayer subsidies for the people who are sick, but for the people who aren't sick, let's give them affordable health insurance so we don't need to subsidize them, and give them different insurance. I'll give you an example of what's happening in Mississippi. Okay, Mississippi, the state's largest insurer, Blue Cross and Blue Shield, has never offered Obamacare exchange coverage. Never. And yet, if you are a small business person or a self-employed person in Mississippi, you can go buy it, and it's Obamacare compliant, but you can buy insurance off the exchange from Mississippi, Blue Cross and Blue Shield, but not on the exchange. On the exchange, you have one insurer for the state of Mississippi, and that's Centene. It's a Medicaid managed care insurer. So you see what's happened in Mississippi is one group is in one market. People who are low income and sick and want subsidized coverage, they're going to get it from one insurer there. People who are middle income are going to go to Blue Cross off the exchange, and there's going to be a significant premium difference. I mean, we see this in New Mexico. There was an insurer in New Mexico, Presbyterian Health. It was a offshoot of the Presbyterian Health System, which is big in Albuquerque, in that area. And they were on the exchange. They had big losses. They left the exchange, and they said, it was 30% more expensive on the exchange because of the different population. This year, they're applying to go back on the exchange, and this is what's interesting. They've been offering coverage off the exchange to people who are just, self-employed small businesses. Now that they want to go back on the exchange, they've asked for an 18% rate increase because they say, when we go back on the exchange, we're going to have a much sicker population. So you see the difference there. So as insurers separate and as customers separate, that's just what's happening in the market. And so states are coming along with proposals to HHS for state waivers to, in effect, build on that and to say, look, we're going to direct more of the federal money to the people who have medical conditions and need help, but what we're going to do is get the other people out from under the costs of this.
Is there, and I still remember that wonderfully echoing video of Jonathan Gruber saying that if you had told everybody that healthy people were going to pay in so sick people could get benefit, it wouldn't have passed. And I hear that in what you're saying again, Ed. Are we going to get back to a place where you are your own customer for health care? I think of Virginia, where Terry McAuliffe, of all the things Terry McAuliffe did as governor of Virginia, he signed a law into the books that allows for direct primary care associations to be formed in Virginia. Amazingly to me, I don't know if he was looking the other way or if Hillary was on the phone with him.
That doesn't necessarily have to be controversial, and in fact, that could work with Obamacare coverage.
Right,
too,
and that's what I mean. But it's a great opportunity.
Well, you see, and what you're touching on is the sort of next phase, if you will, of focus on health reform that we're looking at. And that is, while there's about all this issue about Obamacare, the reality is that Obamacare screwed up one small market. In other words, you got 330 million or how many million people in this country, okay? The number of people covered by individual insurance before Obamacare was about 12 million. Okay.
Okay.
And you've got like 150 with employer coverage. You got 45 million with Medicare. And Obamacare did two things. It screwed up that 12 billion market, and then it expanded Medicaid from about 60 million to 75 million. And you've seen that in Virginia.
Yep.
It put able-bodied adults onto Medicaid.
Middle class workers. I mean, people
mostly low-income younger adults. I mean, basically the people who went on to Medicaid. Medicaid was already covering the poor kids and mothers, the disabled people, the poor elderly. It was wraparound for Medicare. The people that were left that weren't covered in that income range, and Virginia just went through this, are able-bodied adults, and it varies from state to state, but basically 80 to 83% of those nationally have no kids. They don't have any dependents. They're just themselves,
okay,
or themselves and a spouse. And you're going up to about 138% of poverty. Well, if you worked a federal minimum wage job of $7.25 an hour for 40 hours a week for 50 out of 52 weeks a year, that would put you right at about 125% of poverty. So that's what we're talking about. And half of these people are between 19 and 35.
Oh, okay. So right out of school, kind of.
Right. So what you're doing is when Virginia expands Medicaid, they're putting people who are basically younger with no kids, lower wage workers with either little or no work. I mean, frankly, now because there's no asset test, you're putting graduate students on Medicaid.
Yeah. It sounds like it, yeah.
And you're putting somebody working at, I don't know, like Home Depot or something at, in their 20s out of, at a minimum wage. You're putting them on Medicaid. So that's what you're doing. But the point is that what Obamacare did is those two things. It expanded Medicaid and it screwed up the individual market. What you're referencing is the next phase, which is the real cost driver here is not the insurance arrangements. It's the providing the care. And
exactly.
So direct primary care is the idea that instead of paying on a per-visit basis, you buy on a monthly subscription basis the services of a primary care physician.
Right.
Now, this is like, pay-per-view versus Netflix monthly subscription. Right?
Yeah, I agree.
And this is a very good thing because what happens is you get rid of a lot of paperwork, a lot of overhead. The physician can do what he or she went to medical school to do, which is practice medicine, not practice paperwork, and can actually charge the patients less because they don't have to support a lot of overhead in their office. They don't have to have a half dozen people doing billing and all the other stuff. So the physician can charge the patients less, and the physician can still take home more money.
And I see it working around the country, and I'm hoping we can get it started here in Virginia. But you talk about the cost of providing the care. We see the horror stories coming out of England. We hear stories similar to that coming out of Canada, where the state and really the single-payer state healthcare systems are very much where Medicaid is probably going to wind up, as far as I can see it. Maybe I'm wrong, Ed.
Yeah.
But at some point, when is the first case of Virginia or Maryland or somebody saying, yeah, we're not going to cover that? No, I'm sorry, Grandma can't have that dialysis anymore. It's
this happens all the time. We already do this. That it's done in private insurance, but it's also done in Medicare. I actually wrote about this a while back. We had an instance where there's a thing called an implantable cardiac defibrillator, which is basically an implanted pacemaker. I described it as the device that keeps former Vice President Dick Cheney from being the late Vice President Dick Cheney.
Yes.
He has one.
Yeah.
And this was a number of years ago, where it was, the device itself is expensive. Of course, you have major surgery to go with it.
Mm-hmm.
And Medicare had rules for what patients that was medically necessary or appropriate for. And they were fairly narrow rules, so a lot of patients didn't get it. And in fact, the private sector had broader rules, and more patients in private coverage qualified for it than in Medicare, yes, at the time. And the American Academy of Cardiology and the American Heart Association, they were all lobbying the government to change the rules for how, who fit the criteria for qualifying for one of these, right? So after several years of this, they changed the criteria, not even for Medicare, not even as far as the private sector, but they expanded the criteria. And then Medicare put out a press release about this and said, because of this change, we're going to, we estimate, 5,000 more people, lives will be saved per year. To which my response was, so in other words, 3 years of foot dragging, you needlessly killed 15,000 people.
Right, and so 15,000 families are now looking at the government as you just told Grandma she can't continue, or Dad even.
Right.
I mean, you're not.
Yep. So the point is, on some of these things, we're already there. What you're referencing is the fact that the resources become so constrained that this becomes wholesale. In fact, my colleagues just published one about what happened in Britain this year in the winter flu season. They got hit with a bad flu season, but because the resources are so constrained, they weren't able to cope, and they just had to cancel tens of thousands of operations because they just couldn't meet the need.
And that's what concerns me, is that then where does the population go? I mean, we just watched Charlottesville rail against the police department. When do we start marching against our health companies?
This is the question I would suggest you or your listeners ask if you're ever in the audience with a candidate who's proposing a single-payer or Medicare for all kind of solution. I would ask them this question, and that is, under your plan, if the system that you're proposing can't provide what my relative needs, my kid or my parent or whatever, where do I go to buy it on our own?
Aha.
And the answer is going to be very instructive.
Interesting. Yeah, when we have a few of them.
Because under Bernie Sanders' bill, you're not allowed to do it.
You just can't. There would be no provider.
Well, under Medicare today, if you wanted to buy, just say to the doctor, hey, I'm on Medicare, and I rather than having Medicare pay for this, I'll just pay for it.
Right.
The doctor, to participate in, to legally accept that money, the doctor would have to not treat any Medicare patients for several years.
That's what I mean. That's the kind of thing that I feel is going to cripple us at the end. And
well, I think that's why between that and the tax increases you would have to pay for it. Is why this thing is going to, I mean, our friends on the left are all very enamored of this, but the reality is, I mean, there's a reason why other countries have single payer that we don't. They set it up back when medical care was cheap, and you could say, hey, for a 1 or 2% payroll tax, we'll provide you free medical care. That's what they did in Britain in the 1940s. Well, in 1940s, medical care, 1948 when the British National Health Service came in, medical care was cheap. Why? They couldn't do anything for you.
Right. So now we're living longer.
There were no MRIs. There were no drugs for, heart
cancer.
Disease. There were no. I mean, I was a kid. I remember as a kid in the 60s, the moon landing was a big deal, but the other big deal was the first heart transplant.
Yeah, absolutely.
We now do heart transplants in this country. When was the last time you saw an article in the newspaper about a heart transplant?
No, they don't anymore. It happens all the time. It's not outpatient, but
we do a few thousand a year, and nobody notices.
Edward Haislmaier from the Heritage Foundation and the National Center for Public Policy Research. Thank you for joining us this week on this issue.
Thanks for having me.
And thank you for listening. For all of us here at the Virginia Institute for Public Policy, so long and thanks for all the fish.